Stem cell therapy has advanced light years in the last couple of decades, and now it's being used to give new life to patients with debilitating injuries. Dr. Dennis Lox, a world-renowned expert in stem cells, regenerative medicine, and sports medicine, joins us today to discuss this fascinating field of medicine. Good morning, doctor. Glad to have you here.
Good morning,
So I'm fascinated by this because when you think of stem cells, I feel like this is the future of medicine. This is where it's headed. Talk to me a little bit more about stem cells. Explain, if people are, for whatever reason, hearing about this for the first time, explain what you and your team are doing here.
Well, it isn't exactly new. Stem cells have been used in medicine for over 40 years. With bone marrow transplants for leukemic patients. They were replacing blood cells, but they didn't realize they were replacing stem cells at the same time. But they were giving raw tissue, which required severe immunosuppressive drugs with a lot of side effects. We've just become more refined, and now we can transplant just the stem cells without having to give immunosuppressant drugs. So we've just become much more sophisticated in how we deal with it. And in the last decade, our fund of knowledge has greatly expanded. And when I got into the field, there was a few universities doing it, but now just about every major university, if they don't have a stem cell department, they're not, with it. So it's a very burgeoning field in all areas of medicine with research.
And when you hear the word knowledge, I want people to know how experienced you are in this. This is your passion. You've done a lot of studies on this. I mean, talk about why that's important, especially when we are kind of the launch of where we're seeing this more, why it's important to go to a doctor, an experienced doctor in this field.
Early in my career, I've always done orthopedic sports medicine. And I noticed that patients weren't getting better, and especially with as they were older with arthritis, things like cortisone shots and arthritis pills, they don't fix anything. So you would watch your patients over the years and they wouldn't get better. And so I used to say, someday we'll have stem cells. And
that day is now.
Well, that day is now, and that's why I kind of got in very early, and I was one of the pioneers in it. Because
but you're fascinated with the science behind this. I mean,
that's correct.
You really want to make sure you're doing it right, knowing why it works.
I became quite obsessive about reading everything, and I lecture nationally, internationally with some of the most prominent scientists in the world, but I thought it was important to really understand it and portray myself as an expert and be able to explain it to my patients no matter what questions they ask me, because there isn't complete uniformity. There are other doctors who believe in certain things, and so I found it important to read as much as I can and understand it and work with various professors around the world, and you develop your own sense of what is real for you, and then that transitioned to my current philosophy of treating each patient individually based on their needs, not having a cookie cutter template where everybody gets the same thing, because it isn't like that. All patients are very different. A lot of the university studies doing animal studies will have better results in humans, but the animals are all uniform. They are given the same food. None of the animals run marathons, and my patients do. So there's such great variability. Well, and that brings up an important note here before we close, is that this is your own stem cells. I think, again, as this kind of launches, people need to understand what type of stem cell this is. Correct. In the United States, there are certain rules. We can do stem cell treatments, but it has to be your cells, and it has to be the same day. And as long as you're doing that, there isn't any problem. There was an issue over embryonics. Well, we use your own cells, not embryonics. And the Vatican even supports the use of stem cells, just not embryonics.
Well, doctor, I wish we had the whole hour. We have to wrap up. The good news is you are going to be back. You're going to be back with some of your patients as well, so we're going to hear some success stories. We can't wait for that. In the meantime, people want to find out more, there is your number to call, the website as well to go to learn more. Thank you so much, doctor. Again,
My
you can
pleasure.
tell your passion. We're excited about future segments with you.
Thank you.